Good evening and welcome to the Doctors Hospital Virtual Distinguished Lecture Series. I am your host, Marketing Director, Doctors Hospital, Alexis Burrows, and I am happy to be joined tonight by a wonderful team, all working in the space of autism in a lot of different ways. For those of you who don't know, April has been celebrated all month as Autism Awareness Month. So we are joined tonight by a pediatrician and Dr. Deshawn Saunders, who's also a representative of REACH, which is a local organization that assists in providing support and information with regards to autism. We are joined by three members of our rehab team, two speech language pathologists in Krista Major and Kate Shanique Hudson, and also a physiotherapist in Jordan, an occupational therapist in Jordan Moxie. So we're going to have a very interesting and engaging conversation tonight. We're going to start off with Dr. Deshawn Saunders. So she is presently a pediatric consultant with the Department of Pediatrics and serves as chief pediatrician at the Princess Margaret Hospital. She has recently held the position of deputy medical chief of staff at the hospital before becoming the departmental head of pediatrics. She completed undergraduate studies at the College of the Bahamas and Acadia University, where she obtained degrees in biology and chemistry. She then furthered her education, completing her medical training at the University of the West Indies Faculty of Medical Sciences. Dr. Saunders feels that the foundation for a healthy life is established in childhood, which is what makes pediatric medicine so special. She completed postgraduate training in the field of pediatrics at UWI Jamaica in collaboration with the UWI School of Medicine and Research in the Bahamas, and was the first Bahamian to graduate from this program. Once again, She functions presently as a pediatric consultant lead for her clinical ward team services, head of department, and directs the pediatric infectious disease and her team's general pediatric clinic at PMH. She's continued her service lecturing medical students, where she serves as clinical tutor in pediatrics at the University of the West Indies School of Clinical Medicine and Research. Dr. Saunders loves the field of development and behavioral pediatrics and has continued training in this field with certifications with the American Academy of Pediatrics and is certified in developmental testing and autism diagnostics with Vanderbilt University. She collaborates and has a working partnership with Professor Jeffrey Brosco, developmental and behavioral specialist and associate director of the Mailman Center Developmental Center at the University of Miami. Her specialty is in pediatrics with a keen focus on developmental and behavioral assessments, including the identification and support of children with autism. Dr. Saunders volunteers her time within the autistic community in the Bahamas, where she serves as one of the board directors for the REACH organization and works part-time in her role as a pediatrician in private practice. She recently opened up a state-of-the-art pediatric healthcare facility called Kids First Pediatrics Clinic that caters from newborns to young adults. Kids First Pediatrics is in the heart of the Cotton Tree Traders Plaza along East Bay Street. So without further ado, I welcome Dr. Saunders to talk to us tonight about autism, to talk about the role that REACH plays in the country as it pertains to the management, the care, and the support of those who are managing and living with the autism and exist on the autism spectrum. So I will turn over now to Dr. Saunders, who will present on the same. So allow me to share my screen. Thank you.
122 have been diagnosed with autism. This is a startling number when we look at the numbers in the 1990s and the early 2000s, about 100 Many children with autism these are kids that may have babbled. In addition, these are kids that may not be eye contact, they may not be social in terms of wanting parents to hug and hold. When we look at autism, however, every child is different and they may not have the same symptoms as another. Next slide. So what is autism in the Bahamas and what are our numbers? As indicated, in the US, it's presently 1 in 36 children. The Bahamas has approximately 5,000 live births per year. And so if we were to extrapolate that, it means that we have approximately 140 children per year that are actually being born and may be diagnosed with autism. When we look at these numbers, comparing to 5 to 10 years ago, there's an increase of about 15% in the last 2 years. As a result of these numbers, it now shows us the role for increased need for schools and other intervention programs. The REACH organization, along with medical professionals, our goal is to presently find out what are our exact numbers of autism and kids with developmental delay in the Bahamas. And so definitely over the next few months, we will try to get those numbers. Next slide. So I always get the question, why is there an increase in our numbers? So forums like this allow increased public awareness of the disorder and also for symptoms. In every family, there's either somebody that knows a family friend, whether it's a cousin, whether it's a relative, even children that may be their own, that present with symptoms. In addition, broadening of the diagnostic criteria for autism now allows us to separate kids with autism from others that may have intellectual disabilities, such as mental retardation, which we no longer use, or whether these kids may have other co-occurring genetic syndromes, or whether these kids may just have isolated disorders, such as isolated speech. In addition, the increase in cases also involves the availability of early diagnosis and intervention. In the past, most kids were picked up closer to the age of 5 or when they were going to primary school. However, we can now diagnose kids from as early as 12 months, and our gold standard is 18 months. As a result, with earlier diagnosis, it means that we were now able to pick up a higher number of kids that may be on the spectrum. Next slide. So when we talk about REACH, what is REACH? REACH stands for Resources and Education for Autism-Related Challenges. And a lot of persons wants to know, what exactly does REACH offer? First of all, we're a non-governmental organization that was established in 1999. And this was brought about by a group of parents who noted that they had children or family friends that were on the spectrum, and there was limited support, limited school structures. And as a result, this group was formed over 25 years ago to increase autism awareness and education in the Bahamas. Over the years, REACH has evolved with hiring, well, not hiring, but volunteering a board of directors, and our role is to help with the provision of free resources and services to children and families affected by autism. And so when we look at our board directors, yes, some of them are parents, but also we have medical professionals, we have special education teachers, we have speech pathologists, and also lawyers and other persons from other professions that come together to help with finding out ways to help our children. Our office is located at the Queens College campus, and we have full-time staff, including a speech therapist, where we're able to offer services to our children. In addition, the REACH organization offers a free summer camp every year where we have a 4-week program where we're able to offer our children some of the services that we will talk about in this presentation, including speech therapy, occupational therapy, behavioral therapy, and educational services. In addition, the REACH organization also has monthly parent support meetings where we're able to speak with parents to be able to educate and update them on autism. Next slide. So when we look at autism, sometimes persons may not be aware. But when we talk about social differences, some of the things that we may look for may include a kid that's not keeping eye contact or is having very minimal looks, a kid that may not show any response to smile or other facial expressions, a kid that may not focus or look at objects, a child that prefers to play to themselves or they play with older children or adults, or with older kids, a child that may have difficulty making and keeping friends. Next slide. When we look at communication, some of the signs that we may see with a child with autism can include a kid that has no single words by 15 months or no two-word phrases by 24 months. These are kids also that may have what we call reciprocal communication in terms of they may not be able to point, they're not expressive. In addition, if kids are verbal, they may have what we call echolalia, and that means they're repeating everything that you say. So they almost act like parrots. In addition, some kids may ignore name calling, and this is usually the most common things that persons come with. The parent always says, I think my child can't hear, because they're not responding to their name. They're not responding to when you call them. Other communication differences may include no imaginative play and also what we call regression in milestones. So these are kids that may have been verbal before, and over time, they no longer have words. Next slide. When we look at behavioral differences, some of these kids may rock, they may spin, they may twirl fingers, they may walk on toes for a long time or flap hands with excitement. In addition, they may have unusual activities, whether it's repeatedly watching television programs, watching a script, repeating scripts. Also, in terms of play, they may not have functional play, meaning if they're playing with a truck, instead of driving a truck, they may be more interested in the parts, whether it's spinning the wheels, examining the parts. And in addition, they may have sensitivities, whether that's sensitivities to smell, whether that's sensitivities to sound or light. So for example, some kids may hold their ears with loud noises. Some kids may flip the light switches on and off, on and off, on and off. And in addition, some kids may have what we call unusual vision or unusual gaze. And so instead of looking at objects straight on, they may look at the corner of their eyes, or they may get down on eye level if they're playing with a toy. Next slide. So the question is always asked, how is autism diagnosed? So we as medical professionals, there are no special blood tests, there are no CAT scans or screens that can diagnose autism. However, if we were to see a child that may have what we call neurological deficits, meaning that the child may have weakness in the arms, or they may have a delay in walking, or we notice that there's an abnormal neurological exam, of course, that kid would require imaging. But we would start with initial standardized screening, and that starts from about 18 to 24 months. And so when your child would come for their well visits, at that time, your pediatrician or your family medicine provider should start that evaluation process. And we would look at simple things. What's the child's language? Can they walk? Can they talk? How do they interact? Are they social? How do they eat? Are they picky with foods? And all of this involves a part of our developmental surveillance so we can pick up kids that may be delayed. If a child has concerns, we are always of the recommendation that a child should have a formal evaluation, whether that includes the ADOS, which is the Autism Diagnostic Observation Schedule, or CARS, which is the Childhood Autism Rating Scale. In addition, any child that has delay, especially speech delay, we always would recommend that we start with hearing testing because we need to ensure that the child can hear. Next slide. Once we would to have met a child, our role as clinicians involves, first of all, starting with a careful medical examination, also taking an adequate history that involves the developmental and behavioral follow through, including a family history and also doing a thorough physical and neurologic exam. Once this is completed, we have to ensure as clinicians that we review a child's behavioral history, and that includes direct observation so that we can ensure that we are documenting whatever symptoms and signs the child may present with. In older kids, formal assessments including language, cognitive, and adaptive abilities, and also their sensory status, whether they're smelling, tasting, touching, the way they look at objects, or even having sensitivities to noise, is an important component of the diagnostic process. Next slide. When we look at autism, a lot of persons look at autism as being by itself, but no, it's not. Autism sometimes holds hands with other disorders, whether that's seizures, whether that's sleep disorders, in older kids, whether that's ADHD, which is attention deficit hyperactive disorder. Other comorbid illnesses that hold hands include things like anxiety, mood disorders, behavioral disorders such as food refusal, self-injurious behaviors, and even aggression. And some kids that also have autism may be diagnosed in addition with intellectual disability. Next slide. So what are the interventions? So we talk about autism, we talk about the diagnosis, but how are we able to help our children? The goals of treatment of children with autism includes firstly minimizing the core deficits, whether that's social communication, whether that's their restrictive and repetitive behaviors. And our goal is to maximize functional independence by facilitating learning, whether that's through functions such as speech, whether that's through occupational therapy, whether that's through behavioral therapy. But our role is to minimize and prevent problem behaviors that may interfere with a child's normal function. Interventions for children with autism include educational practices, developmental therapies, and behavioral interventions. Next slide. Some of these interventions include speech therapy, occupational therapy, applied behavioral therapy, and also educational interventions that involves classroom-based models. Next slide. What is the importance of early intervention in autism? As indicated, some children can be picked up from as early as 12 to 18 months. And studies have shown that positive effects on development is a result of early intervention. There was a study that was done for children between the ages of 2 and 4, and it showed that if a kid could be picked up before the age of 4, they had a 40% chance of amalgamating into a regular classroom as they got older. As children are young, their brain, we call it plastic, so it is continuing to mold. And so the brain has a larger potential to learn when the kid is younger. Studies have shown that there's a sensitive period for brain development, especially between 1 to 4 years. And because of this increased sensory input, if early intervention can take place, it definitely shows an improved language and motor skill development in these children. So early diagnosis leads to earlier treatment, which leads to improved diagnostic for our children. Next slide. So when we look at REACH, as this year, our theme is embracing inclusion, because autism is an infinite spectrum of possibilities. And so we as an organization would be happy for you to reach out to us at our telephone numbers 328-4123, 447-6016, so you can get more information on autism or also some of the facilities that we provide. Next slide. All right, so thank you.
All right, so thank you very much, Dr. Saunders. As we prepare to transition into the next phase of our conversation tonight, we will be joined by, as I mentioned earlier, 3 of the members of our excellent rehab team here at Doctors Hospital. And that would be, again, speech language pathologist Krista Major and Keishanique Hudson, as well as occupational therapist Jordan Moxie. And again, thank you to Dr. Saunders for such an excellent presentation. One of the things that we've been attempting to do in the past few weeks, and we had another pediatrician, Dr. Remy, featured on the podcast, is really bring awareness to the full spectrum that is autism, from, you know, how it's diagnosed, how it's treated, and the organizations that are assisting in helping to further that message and to assist those who do have or exist on the spectrum. So again, thank you to Dr. Saunders for that presentation. So now we're going to get into some questions with our rehab team in particular, and just going through a little bit more of a deep dive of where rehab fits in the space of autism, because, you know, it may not be obvious at the outset of where that particular area of medicine fits into the conversation. But we have three very well equipped and knowledgeable ladies who are here to assist us tonight, and they will also be joined by Dr. Saunders as well. And then once we go through the panel discussion, we'll also open the floor to questions from our audience. And so we have the Q&A section is open. So if you have questions, you can start to plug them into the Q&A now, and we will answer those once we complete the next segment of our conversation. So as soon as we are all set from a technical standpoint, we'll move into that portion of our discussion. I hope everyone is enjoying the presentation thus far. And, tell a friend if you, having listened to Dr. Saunders, and it's always very interesting when we have this conversation, because you start to think about, well, do I have signs as an adult? Do my kids have signs, kind of thinking through it. And obviously we encourage you, if you are listening at home and you think that you may have the potential that you or your child is on the spectrum, to be sure to reach out to Dr. Saunders or to the REACH organization, and even to our rehab team for additional resources, additional educational materials on the same. So we are all set to move into the next phase of our discussion. So again, introducing from left to right, right to left. So left to right. You obviously heard Dr. Saunders already. Next to her, we have Shanique Hudson, who is one of our speech language pathologists, followed by Krista Major. And on the far right, we have Jordan Moxley, who is an occupational therapist here at Doctors Hospital. So let's show these wonderful ladies to you as we move forward. 1 second. So as we just sort out a little bit of our technical difficulties, one of the things that we'd like to discuss tonight is the idea of where speech and language pathology, as well as occupational therapy, fits into the overall discussion with regards to autism. So I'm going to open the floor, and anybody who wants to dive in and answer first, feel free. But I guess starting with speech and language pathologists, where do you fit into the overall conversation about the treatment, the diagnosis, the screening for autism? Oh, sorry.
Thank you. Good evening. I think we fit in where parents usually notice the child is not talking first. I think many times that's the first thing that they see. My child is not talking. That's the first red flag. And they often come to us to say, okay, we need a speech and language evaluation, or we're concerned about this, or we'll get that referral from the doctor to say that they've noticed that in the child's wellness check that they haven't been meeting the milestones within speech and language. And so that's where we come in and evaluating and diagnosing the speech and language difficulties that the child may have, or any social communication difficulties the child may have.
Okay. And what about, sorry, do you want to add to that, Krista?
No.
Okay. And then, so Ms. Moxley, what about occupational therapy?
Good evening, everyone. So from an occupational therapy standpoint, it's kind of, a lot of times parents only want to hone in on, oh, my child is not talking. So we fit in the mold where, yes, your child's not talking, but we also want to look at, is my child engaging in certain activities? Are they able to bathe themselves? Are they able to feed themselves? And so along with getting the referral from a doctor, we will be able to fit into that same mold where you come in, as soon as you come from your physician, hop on by and get your child, evaluated for things that they are supposed to be able to do in terms of developmentally.
So what key improvements have you noticed in the ability to diagnose autism and treat autism in the Bahamas in particular over the past decade?
All right, so what's changed in the past decade? Children are usually diagnosed by the age of 5. And so it meant that we missed almost 4 years of early intervention. So most kids were picked up when it was time to go to primary school. But what has changed over the last 10 years is earlier diagnosis. And so we can diagnose a kid from as early as 18 months. So that means that kid has not even reached the age of 2. And if we're able to pick up a child that early and they're able to start early interventions, whether that's speech therapy, whether that's occupational, whether that's behavioral therapy, we've actually seen improvement. And so if a kid may have been picked up by the age of 2, depending on their level of autism, once they were to get early interventions, by the time they're 4, some of these kids can become verbal. Some of these kids are not functional. They're being able to potty train, feed themselves. And so early intervention is something that we've seen over the years, and also availability of resources to help with the diagnostic criteria, but not just help with diagnosis, but also help with intervention, has shown a remarkable improvement and success stories for many families once they're picked up early.
Right. And how has the availability of resources and specialized healthcare professionals contributed to the progress in autism care in the Bahamas?
I believe over the years, we've really grown in our different fields. So many years ago, we would not have had many SLPs, we wouldn't have had many occupational therapists. So over the years, we've seen a lot of people come home with their studies in speech therapy. They have come home, they're now occupational therapists or behavioral therapists. So that really has improved the way that we kind of tackle autism because we have more resources now. We have more people on the ground doing the work. So I think that that has really made a change over the years.
Okay. And in what ways has technology played a role in enhancing, again, either autism diagnosis or treatment strategies locally?
So I know from a speech and language perspective, using an AAC device or a tablet that generates speech is one of the most common, or one of the common methods of treatment that we use for children that are nonverbal and diagnosed with autism. We often recommend that they use that device to either assist with some of the single words that they may have, or just to completely facilitate and replace the verbal language that they would be using.
Okay, and
Sorry, I just
go
want
ahead.
to add in,
Sure.
just even in the last couple of years, the use of social stories, those have been really helpful for parents, because now, even nowadays, you can find social stories that you kind of organize yourself that makes it more relatable to the actual child, rather than just finding a random social story. So I think that's been also been helpful for, again, the same bathing, dressing, even in preparing children for different tasks. So preparing to go to the doctor, going to the dentist. So those things have been really helpful.
And what are some current challenges in providing comprehensive support and care for individuals with autism in the Bahamas? And how can these challenges be addressed?
Since I have the mic. In terms of comprehensive, sometimes it's hard to find all of the services housed together. So it's very hard when you have, let's say you go to a pediatrician, then you have to go to a specialist, and you have to go to an OT, got to go to speech and language. So it's hard to kind of get them all together. And so I think now that a lot of facilities now are at least trying, I'm not sure how well it's going, but a good try to get all of the services together in one space, so that way parents don't have that anxiety to be like, oh, I need to go here, there, and everywhere for their kids.
I also want to add another really big challenge is, although we've made improvement over the years with the resources in therapy, we still have a lack of behavioral therapists, and a lot of patients we treat, we notice that they really need that as well. In addition to the occupational therapy and the speech, is really a team, and we have more of us than it is of them. So a lot of parents come and they tell you, oh, I'm trying to get in and I'm on a waiting list. And sometimes that waiting list for behavioral therapy may be a year or more. So it's really a challenge for parents when they want to get the resources, but even though we've come so far, we still need a little bit more. So hopefully over the years we can make a change.
So just to add into us, they talked about therapy, but even the educational intervention schools. All right, school is a big challenge, and that goes from preschool even to primary school. They also have waiting lists and not even a waiting list availability. And a lot of schools are kind of streamlined. They don't want kids that are special, and so, that's a big challenge because where does a parent take their child? Hey, I have a 3-year-old that's not talking, may have some behavioral concerns, but the challenge is also school placement. So a lot of parents keep these children at home, which is not a benefit to them. It actually
Right.
takes away because they need to be social. I always say to parents, especially in the toddler age, they should be in blended classrooms where they're with normal children, typical children, kids who are singing and talking. And so they're able to glean and learn. But I think overall, not just the therapeutic interventions, but even the educational resources is a big disparity here right now in our country, and it's something that we need to, as a grouping and a country, address.
So considering the progress that's been made thus far, where do you think we go next in terms of research, advocacy, policy development to further improve autism care in the Bahamas?
So I think that's a very important question. Research is needed because one of the big questions that we have, and is worldwide, not just in the Bahamas, what causes autism? And so I think that more research needs to look into that, whether it's the food, whether it's air pollution, whether it's something in the water. I know over the years, a lot of persons thought vaccines, but there's not been any literature to confirm that. But I think that we have to definitely come up with our numbers because we, as a nation, we don't know how many kids we have. In addition, also in terms of providing the resources, so making our governments more aware. So yes, our governments are hearing us, but I think we now have to have policies in place for schools, policy in place for therapy. And so I think it has to be from a legislation standpoint that we're able to assist our families and our children that may be on the spectrum.
All right, so we're now going to, go ahead.
Sorry. I was just going to say also, we also need more persons who are even involved in therapy because I know as an occupational therapist, there's only so many of us, and I know even smaller number for, SLPs, but if we have more persons who are interested in the field and getting them educated and getting them into the field, then you have more kids that will be able to be seen. And because especially with their numbers increasing, you'll need the resources as well. So then for that.
All right. So great job. We're now starting to get questions come in from our audience. So we'll shift gears into that space. And the first question that we have is, where can I get testing done in NASA if I feel that my kid may exist on the spectrum?
Perfect. Well, luckily for us, we have Dr. Sanders, and she is a perfect example of, she's out there and she's an advocate. I would definitely say she's given us a lot of resources, and with her presentation, she's told us tonight, you can start as early as 18 months. So if you have any questions or concerns, I would definitely reach out to her. If you do have a pediatrician for your child or any other medical physician, I would say reach out to them and inquire if they do have the testing. But like we said, Dr. Sanders, she has the experience and she definitely have the resources for you.
Okay. Another question we have coming in from the audience: how can you tell the difference between, I guess, a simple language delay versus a kid existing on the autism spectrum?
Okay, so they passed it back to me. It's fine. All right. So a kid that has simple language delay in terms of, so when we look at development, we look at 4 spheres. We look at motor development. So that's a kid that was walking, running. We look at fine motor. What can they do with their hands? Can they dress, undress themselves? We look at social adaptive skills. How do they interact? How do they relate to other persons? And then we look at language, which is both expressive and receptive. A kid that usually has isolated language delay, that would affect that one domain, which is the expressive and receptive. So meaning what the kid can say, but also if they can't hear what they're understanding. But when you have a kid that also has social concerns, meaning that they have eating aversions, sensitivities to noise, not interacting with other children, motor mannerisms, so hand flapping and toe walking, that has nothing to do with language. Okay. And so when we start to see kids delving into more than just the language deficit, but also having the behavioral concerns, the social deficits, it means that this may not just be isolated speech delay, and we definitely want to further investigate that child.
So another question coming in from our audience: how can schools, whether that be teachers or administrators, play a more integral role or take part in students' development who may be autistic or may exist somewhere along the spectrum?
So I often encourage parents when they come in to get tested for speech and language, I would often encourage them, once I give them the goals that we'll be working on in therapy, share it with your child's teacher, because we want to encourage generalization and carryover of the skills that they're learning in therapy. We want that to be carried over into the home as well as into school. So I often encourage them to share those goals, share the progress that they're making, and ask teachers to also participate in helping the child in the classroom, working on those things specifically. I know that we have other kids in the classroom, but when you get your child in an environment that, acknowledges and caters to their diagnosis, it's very helpful for them, and it really helps with their progress.
What advice would you give to parents that delay assessment for autism or reject a diagnosis because they are afraid of their child being labeled?
So I often see this a lot in parents that come in for a speech evaluation. Their main concerns are often only speech. My child understands, they're just not talking. So I would definitely let parents know that don't be afraid or scared of the label. It's better to know so you can, get the resources and get the help that you do need. Waiting and just trying to figure it out and assuming that, my child's going to be treated differently if I go to the pediatrician and I get this assessment, it's really hindering them. It's really holding them back. So like Dr. Saunders mentioned, early intervention is very important. So if you're waiting till 5, 7, and your children are not, aren't able to give you eye contact, have actual conversation, even simple sentences, these are really major concerns, and that's going to keep them back educationally. It's going to keep them back socially. In the community, you got to think about their future. So when, you're long gone and, they're there to take care of themselves, how are they going to be able to do that if, they're still, at that 5-year-old or even a 2-year-old level, and they're now 16. So you have to put yourself out of, the situation and think about the future for your child. And there's a lot of resources now than it was in the past. So you may see a lot more based on, the help that you get. You'll see more in their education. You'll start to see more at home with their independence. So it's really good to just make the first steps and get the help. Don't be afraid and be your child's advocate.
Okay. I think this is a question for Dr. Saunders. We have someone asking, how do they sign up for the summer program? I think you mentioned during your presentation that REACH has some summer initiatives. So how does somebody go about getting more information and signing up for that?
Definitely. So they can reach out to our office. Our office is open Monday to Fridays, 9 to 5. And our telephone number is 328-4135. Mrs. Aisha Watkins, she is our office manager, and she also works with assistants there. And you can call and get further information. There is an application process. We usually have at least 50 plus applicants. We can't take everybody, but definitely we try to get kids that have not had any type of interventions so they can get started. So please reach out to our office. We are not processing applications as yet, but please get on the waiting list so you can get your child involved. As we indicated, it's a 4-week program. It's free, and we are able to offer all services so that at least kids can get some help. So please reach out to the REACH organization.
Awesome. And then likewise, are there any support groups for parents who have children that are on the spectrum?
So REACH is actually a support group for parents. All right. And so that's our main role. And it was actually established by parents in 1999. And so every month we have a parent support group meeting where we actually have persons, both local and abroad, who are able to talk to parents. In addition, there's a WhatsApp group. And so I'm not a part of that group. It's very active, but parents are able to have a forum where, if they're having a concern with their child, they're able to speak with other parents. Because if you look at REACH, we started in 1999. And so it means that those children are now adults.
Right.
And so those parents would already walk that road. And so you have persons that have experience and exposure, and they may be able to say, well, this is what I did to get my child to eat, or this is what I did to get my child to potty train. And so we definitely have a vibrant parent group where we have children, not just on autism, but also other developmental delays. And you're able to meet with them, sometimes somebody just to cry on a shoulder to talk to, just support. And so that's what we offer as an organization, support for all of our parents and children.
Okay. And then another question, is there a neurodevelopmental pediatrician in the country who specializes in the management of neurodivergent children, i.e. medication and other, treatment options?
So that's a good question. We have pediatric neurologists, but we don't have a specific person that delves alone. And so a lot of our pediatricians are also trained, if need be, medications for our children because of the limitation. And even in the US, we have undergone programs where we're able to help these neurodivergent children. And so availability is there. So I'd suggest you either reach out to your pediatrician, family medicine specialist, but there are persons who are able to address the concerns.
Okay. And then the final question that we have for now, unless we see anything else come in, how do treatments proceed with adults with autism? And is there a time that's like too late for treatment to be started or for someone to be diagnosed as an adult?
So something that I've thought about recently is that a lot of times what I've tagline, and you let me know how you think about it, Dr. Saunders, is that we have to have functioning kids to become functional adults. And so even as an adult, you still want to be able to manage yourself and have this independence. So it's never too late to get started with interventions. If you find that you are a neurodivergent person and you might not have the advocacy to fend for yourself, it's good to still have to come in and get your assessment, come in to get your evaluation, come in to get treatment, because you'll still get some form of support. And once you find your support, you find your resources, you're able to you're able to function. And that's, as an OT, I want you to function. So
that's the occupational.
Yes.
So I would say we have a lot of missed adults that are autistic. A lot of times when we're evaluating children, you see the parents looking at themselves and like, oh, I used to do this when I was a child. And so a lot of times you see persons with a lot of social deficits. They have difficulty making friends, difficulty having relationships, difficulty sometimes even functioning on the job. And it could be because they may have been autistic from childhood and never picked it up. And so at that age, we would recommend definitely seeing a psychologist because they can also perform testing and if interventions are needed. Because remember, with autism, it also comes with other comorbid stuff, whether that's depression, whether that's anxiety, whether that's, social concerns. And so definitely, if as an adult you feel that there's a concern, we do have psychologists that are able to address and help.
Right. And I think an important part of that, just based on some of the conversations we've been having, is the idea that because it is a spectrum, it's quite possible, and then especially because of where screening availability, and that was when you start to go back, 20, 30, 40, 50 years, and because it does exist on a spectrum, it's quite possible that someone can, for the most part, function what we consider to be normal, but have some issues due to the fact that it was missed. And so we're now in a place, and I think we see that there's more opportunities for figuring that out. There's more opportunities for treatment and a lot of those things in that space. I think you may have answered this question during the presentation, and please correct me if I'm wrong. But I know there's a question as to whether or not it's more prevalent in boys or girls. And I think you indicated that it's more prevalent in boys. And I think a good follow-up question to that is there any indication as to why that may be, or is it just we don't really know?
Yeah, so that's a good question. Yes, I did address it in the presentation. It's 4 and 1. So for every 4 boys, it's 1 girl, and we do not know. And so that's the big question. Why is it affecting boys more than girls? But it's just something something that we're seeing in terms of the trend. And so hopefully over the next few years, we're able to, and another trend that I did not discuss is that we're actually seeing it doubling in our Black and Hispanic population as compared to the white. And so that's also a very disturbing trend. So not saying that they're not being diagnosed with autism, but somehow our population is showing an increase in numbers. And so that's also another thing that we have to address as clinicians and for the world to determine what exactly is causing the rising numbers.
Okay. Obviously, a question that's always going to come up in a forum like this is concerns about costs associated with care with diagnosis. And so someone asked the question, is testing for autism covered by insurance? And if not, you know, what can someone kind of expect as a cost structure for trying to go through that process?
So I can address that. So it depends on the plan. In terms of the type of insurance you have. I would be honest with you that a lot of the insurance companies do not cover anything related to behavioral development, mental, and that's just how it's structured. So it depends on the plan that you may have. And so definitely you'd want to reach out to your agent to see what exactly is covered. When it goes to costs, you would then have to reach out. We do have what we call the neurology clinic that's at Princess Margaret Hospital. That is a free clinic, and they do not do testing, but they're actually able to refer. The Ministry of Education also does testing, and that's a free service, but that starts at the age of 5. And so you have a lot of different places that you may be able to be evaluated, but you'd have to reach out to each individual institution to be able to address costs. So cost isn't something that we can really address in this forum. Thanks.
Okay. Someone indicated that there hasn't been a lot of conversation around medication throughout this. And I guess the general question is, what is the position of the panel on where medication fits into the space of treatment for autism or someone on the spectrum?
All right, so there is no medication that's used to fix autism. However, if kids have certain features, meaning if the kid is aggressive, they're irritable, then that conversation comes up. So it doesn't mean that every child that has autism needs medication. Some kids that are hyperactive, so whether a kid may have ADHD along with autism, then of course that's the conversation. A kid that's aggressive, self-injurious behaviors, once again, that's another conversation for medication. And so as indicated, autism is a spectrum. Every child is different. And even though we may not discuss medications, if there is the need for medications, then that conversation has to be had. I would say if we were to look at 100 kids, maybe 5 out of the 100 may require medication. And also as kids get older and their diagnosis or their signs and symptoms change, then that conversation has to be had. But it's never an initial conversation for a child or sometimes even older kids, but it all depends on the presentation. Then yes, medication may have to be considered.
Okay. So again, I think this speaks to, and this might have been answered in a roundabout manner, but have persons who have been diagnosed as being on the spectrum, are they able to obtain work once they move into adulthood?
So I think that's more so where we're coming from with the functional aspect of treating them. That is the goal. At the end of the day, we want them to be as independent and as functional as possible. So it's definitely is the end goal. And it is possible for all kids with autism because we want to look at all of them as having that ability and working towards that. So from the speech and language perspective, we want to give you as much functional language and communication that you would need in any job that you choose to have. And then of course, Jordan can speak on the OT side of that.
Oh, I forgot the question. I'm sorry. Yes, thank you. I was drifting off to somewhere else, but that's okay. So I was thinking that, for kids or when they become adults, like I said, trying to get them functional. And so what we also need to speak about is how society also views children or adults that become on the spectrum. And so once society kind of has an open mind in terms of even hiring children that have on the spectrum, or it's because some children may, or some persons may downplay the fact that they have autism just to try and get a job. But if more persons were open-minded of the fact that they have autism, or even accepting persons who have autism, because some kids on the spectrum and some adults are geniuses. Okay, so they do things well, and if there's something that they know that they do well and they could get hired for it, it's a beautiful thing.
Right. So just to comment on that, I think a lot of people look at autism as everybody having significant delay. And as she indicated, a lot of our persons who are autistics are our scientists and our engineers and our IT technicians. And so, yes, they have function, they have lives, and they have families. Of course, they may have social deficits. And so not every child that has autism is the same. And so kids that are level 1 or mild, they go on to function. And even kids that are level 2, they can go on to have a functional life. And so it doesn't mean that autism is a label and you do not have a life beyond this. No, you can live.
And then I think we have two or three more questions and we wrap. Are there selected schools who are known to provide a multidisciplinary approach to students, such as behavioral therapy and educational occupational therapy in the classroom? Nobody. I think we the question there.
So there are very few, but there are some. Many would probably heard of Blairwood. Over the years, they've really had a team approach in terms of they've had speech therapists there, occupational therapists, as well as behavioral therapists. So I think that they've got the grasp of working with kids with many different disabilities. Another facility is Seahorse Institute. They have a lot of kids that come there with a lot of developmental delays, and issues might be speech, occupational, behavioral, and they do have resources there as well. So we do have few, but we do have some in the Bahamas. Yeah.
Okay, so they talked about the private, I'll talk about the public. So in our governmental systems, so we have special education preschools. Those preschools actually have where behavioral technicians and speech therapists come and help with those programs. And so not a lot, but yes, there is availability where kids are able to have a multidisciplinary approach in helping in terms of moving forward. So yes, in the private, but very limited, but yes, you have some availability in the public system too.
All right. And our final question of the night, and I think this is a good place to wrap our conversation because it speaks to, I think, one of the major concerns that people have. What advice would you give to members of the public in understanding and accepting persons or children who are on the spectrum without discrimination?
So as mentioned earlier, a lot of kids do have some behavior issues. And I know a lot of times parents are sometimes scared to take children outside of the home, but those kind of moments, they need to go out to, let's say, go to the grocery store, because then that's again, and that's increasing that functional skills, going to church, because some people going to sporting events. Those are things that will help the child in their awareness. So people who have a closed mind, it kind of affect trying to figure out, oh, that child is screaming over there, but you're not helping in terms of, oh, and sometimes parents panic too, like, oh, I can't bring my child out anymore. So they're having the public eye constantly on them is sometimes it's very hard for parents who have the children. So I would say for the public, just give them a little grace. They need some grace. Just so if you see something, assist. There's nothing wrong with kindness. Yeah.
I also want to add to what Jordan mentioned. So having that exposure will also bring awareness to other people in the community. So keeping them at home would not help, because then we kind of shut our mind off to, if you don't see it, then it's not there. So yes, like Jordan mentioned, bring your children out to church, bring them to the food store. Sometimes a typical developing kid, it's hard to bring them to the food store. I get it. But just once in a while, give them that exposure, because that's also a learning experience for them. Describe the things that you see in the food store. Oh, mommy's going to pick up, cereal. What do we want? Do we want strawberries in our cereal. So all of this is a learning experience, and I could speak for the speech aspect of it. You want to be able to, give your children as much exposure as you can. So don't feel like you're limiting them is going to help you. So again, like I mentioned, take yourself out of it. You got to think about the future for your children.
Okay. And sorry, we do have one final question. What testing and treatment options are available with regards to individuals on the autism spectrum at Doctors Hospital? And what are some of the payment relief options for accessing that care?
So to speak on the testing and treatment options, we do have speech therapists that are at Doctors Hospital that assess and treat the speech and language disorders, social communication disorders, those things. And then we have occupational therapy as well that would deal with those functional skills. We do have the LAMP program. I am not fully versed in all of the features, so that would be something that you should reach out to learn more about, because they do offer those relief options, but I'm not fully versed to give that many details.
Yeah, I wanted to also mention that. So because we have more than one form of therapy at the hospital, so like Shanique mentioned, we have speech, we have physical therapy, and we have occupational therapy. So once you have more than one therapy that's needed, so we call it a bundle. So if your child needs occupational and speech, we do have some deals with that bundle pricing. You can reach out to us at our Collins Avenue location, and we will be able to give you specific values to that. But we do have a really good, I guess, deals going on. And even if you just say your child needs physical therapy too, all three, that even makes it a little bit cheaper. So, so think about that. And then again, I would like to add, I know that some people do have insurance, so we do take that as well. And we do provide additional discounts with that. And when we have self-pay options. So.
And just to add to that, you did mention LAMP. So for our viewers and our listeners, if you are on the LAMP plan, the LAMP prepaid plan, which is if you're paying self-pay, offers a 20% discount on outpatient rehab services, of which this would fall under. And if you do have insurance, or you have your child covered by insurance, our LAMP insured plan actually waives the copay or the co-insurance for outpatient rehab visits. So there are options for limiting or making the care more accessible via our LAMP program. And we'll be sure to just remind people, if you're interested, if you want to know more about LAMP, you can visit www.doctorshosp.com/LAMP, and all of the information related to the different tiers of programs are available on the website if you're interested in going through that. But obviously, that is one of the opportunities that exists in that space. So we are going to wrap our conversation. I want to say thank you so much to the lovely ladies that we've had tonight, Dr. Saunders, Ms. Hudson, Ms. Major, and Ms. Moxie. We are grateful for your time, your energy, and your effort. And for those of you who are watching at home, if you have any more questions, feel free to reach out to our rehab department. You can call through the main hospital at 302-4600 and ask for our rehab space. You can visit our website and go to the rehab page. And again, if you're interested in LAMP, you can visit our website, doctorshosp.com/LAMP, for more information about that program. Thank you to our audience for being a great crew tonight. We had a lot of really good questions. We're always grateful for that. And we're glad to see that you're engaged in the conversation. And we invite you to enjoy the rest of your evening and join us back here next month for another episode or another edition of the Doctors Hospital Virtual Distinguished Lecture Series. Thank you and good night.